This question is very important about clinical pathways in chronic lymphocytic leukemia. And I would argue that maybe 10 years ago that question even wouldn't be asked because we had very few and limited therapeutic choices. The good news for patients and for physicians is that the number of therapies for CLL and other hematologic malignancies has significantly increased. This is very rewarding, and it's really the result of tremendous number of clinical trials and research. The problem is that these agents and these therapies that are being approved for chronic lymphocytic leukemia, as an example, are very expensive, and there are no head-to-head comparative studies to know which drug you actually start first. So in general, what I envision happening is that if we understand which treatment is more effective, this treatment will be selected first. And if both therapies are of similar efficacy, then we look at the lower toxicity. And if all is the same, we look at the one with the lower cost. The critical issue when you don't have the comparative opportunities between these drugs, then you look at risk stratification, and that's where I believe what's going to happen in hematologic malignancies. The way pathways and clinical pathways will be incorporated in CLL will have to incorporate risk stratification of disease. So when you look at chronic lymphocytic leukemia, not all patients with CLL have the same prognosis, and none of them should be managed the same. So we'll look at high risk, low risk, and within each category, we attempt to prescribe the therapy that has the most efficacy based on previously published studies. In the absence of comparative trials, we will have to really defer to clinical judgment. We'll have to defer to the toxicity profile and design and sequence these agents based on that. I do think, though, in the next few years, we will know more about sequencing. There is much that has been presented at this American Society of Hematology meeting about this, and hopefully in a couple of years when we talk again, we're going to know a little bit more about the sequencing.